A respiratory virus is spreading from China to countries in the region and beyond. It comes at a time when the world is already reeling under 4 other viral infections all at once. So are we on the cusp of a new pandemic? Ragini Sudhir Chaure finds out.
China is back in the news. A human metapneumovirus or HMPV outbreak in China has raised the alarm worldwide. The virus has spread to India and some countries in Southeast Asia. China calls it winter viral, but hospital videos circulating on social media paint a different picture. Take a look at these videos. Hospitals in China are reported to be struggling with a surge in the HMPV cases alongside influenza A and mycoplasma pneumonia infections. The videos show overcrowded facilities, drawing comparisons to the COVID-19 pandemic. Schools in Wuhan and other cities in China are closed amid a rise in HMPV infections. The World Health Organization is demanding detailed information from China. Is this the return of a new pandemic? Wuhan, 12 December 2019. A cluster of patients begin to experience the symptoms of an illness that is later identified as novel coronavirus. By 11th January 2020, China had reported the first death from the novel coronavirus. And on the 23rd, Wuhan, a city of 11 million people, is placed under lockdown. A week later, the World Health Organization declared it a public health emergency of international concern. Cut to January 2025, HMPV infections spread in China. Worryingly, the HMPV outbreak has been reported at around the same time of the year as COVID-19 5 years ago, causing panic among people. However, HMPV is not the only problem here. This winter has brought along 4 different viruses. The term quademic is now at the forefront of healthcare discussions in both the United States and the United Kingdom. The word quademic refers to the simultaneous surge of 4 major viruses: COVID-19, the flu, the respiratory syncytial virus or RSV, and the norovirus that are currently overwhelming healthcare systems across the globe. These illnesses, traditionally common during the winter months, are now spreading at unprecedented levels, creating an urgent situation for hospitals that are already stretched thin. COVID-19, the first of these 4 viruses, continues to challenge both healthcare professionals and the public. While vaccines and past infections have provided some immunity, new variants and the holiday season have fueled a resurgence. The flu has surged dramatically in the United Kingdom. Hospitalizations have increased by a staggering 352% compared to December 2023. In the US too, hundreds of thousands have been affected, with vulnerable populations such as children and the elderly at risk for severe complications. Then comes the RSV, which is exacerbating the situation in the US, especially for children. This virus, which causes severe respiratory issues, is overwhelming pediatric hospitals. Then there is norovirus, also known as the winter vomiting bug. It's rapidly spreading through schools and hospitals, further challenging an already overburdened system. In the UK, hospitalizations because of the flu reached an average of 1,861 patients per day in early December, a 70% increase from the previous week and more than 3 times higher than the same period last year. Meanwhile, the norovirus cases were up 10% than the previous week and 64% more than last year. In the US, the situation is equally dire. Norovirus outbreaks are at their highest levels since 2012, and RSV hospitalizations have jumped by nearly 40% in just 2 weeks. Add bird flu to the mix and the world has a serious problem on its hands. The US has reported the first human death because of bird flu or H5N1. Halfway across the world in India, 3 tigers and a leopard have died because of the bird flu at a zoo. India has also reported 7 cases of the Human Metapneumovirus or HMPV, 2 each in Karnataka, Maharashtra and Tamil Nadu and 1 in Gujarat. All the infected patients are either toddlers or infants. According to the Indian Council of Medical Research, none of the infected babies or their families have a recent history of travel.
There has been news doing the rounds about a metapneumovirus outbreak in China. Let me be very clear on that count. Metapneumovirus is like any other respiratory virus which causes a common cold. And in the very old and the very young, it could cause flu-like symptoms. However, we have analyzed the data of the respiratory outbreaks within the country. There is no substantial increase in December 2024 data. In any case, during winters, there is an increased outbreak of respiratory virus infections for which our hospitals are usually prepared with the necessary supplies and the necessary beds.
Unlike the COVID-19 pandemic 5 years ago, this time the enemy is not unknown. Malaysia recorded 327 HMPV cases in 2024, a 45% rise compared to 225 cases in 2023, as per the Straits Times. Hong Kong identified a few HMPV cases. Cambodia has issued a health alert. In Japan, authorities are closely monitoring the situation. Already grappling with a flu outbreak, Japan reported 94,259 influenza cases in the week leading up to 15th December 2024, according to the Japan Broadcasting Corporation. Dr. Soumya Swaminathan, a former chief scientist at the WHO, advises people to take the usual precautions when we catch the flu. Wear a mask, wash your hands, avoid crowds, and consult a doctor if required. With Bureau Inputs, Ragini Sudhir Chowre's report for DD India.